This is Richard Samelka. In this episode, we'll be talking about your being your healthcare steward. And just as an aside, as I was putting on this jacket to give this presentation, I looked in the pockets. So looking in my left pocket, I found medical gloves. So I realized that probably the last time I wore this jacket was going to my medical clinic and treating patients with gadolinium deposition disease. But then I looked in the other pocket and I found this. And so I realized, hey, that's where Gray Mousy went, which is the toys. One of my two small dogs, Astrid, just loves stuffed animals. And one of her favorites are these little stuffed mouses. So I realized I wore this jacket going to the medical clinic, and then coming back home, I was obviously playing with the dog and put her stuffed animal in my pocket because she tends to leave these animals, these stuffed animals outside. So that actually, I also mentioned that because it's important to, in your health, do a couple of things. You have to not only do work, which is important, but you also have to enjoy yourself. So there has to be a balance. And balance is actually something that, I want to emphasize in most, perhaps in some fashion, in all presentations. And that's why I oftentimes talk about the middle road, and quite often like the term, because it's a fun term. I like using the term the Goldilocks principle of being in the middle. And perhaps everything in life, kind of, if you follow the middle path, it's most correct. So I also want to sort of give an overview in this presentation, and I'll use some anecdotes, and I think in the future I'll use other anecdotes to make these same principles. But basically, what I want you to focus on is the concept of wisdom in your own healthcare management. And one of the important tenets of wisdom is to have always in the back of your mind on subjects that you are absolutely certain are correct, to have in the back of your mind, could I be wrong? Now, actually, Bertrand Russell famously made a few quotations along that very same line, and I recommend you go online and look up Bertrand Russell, who made many very important insights about everything that actually we're going through today in our world, including the power of fear and anger as a political tool, which actually to some extent also occurs in medicine. So I want to sort of look at that approach of how I deal with the subject of, quite often what we're seeing these days is seeing competing narratives of healthcare and figuring out, well, how am I going to navigate this? One group says, for instance, maybe I was going to wait, but I'll maybe mention it now because it's sort of a very big topic, is that the conventional wisdom about injuries is that you ice them, over time, and maybe that's in 24 hours. Heat is helpful for injuries, and also to take a non-steroidal anti-inflammatory. I tend to take ibuprofen in that regard, and that's perhaps the only drug, fortunately, that I have to take with any regularity is I take ibuprofen. So, I have laughed in the past about other drugs that have been taken for some indication. It turns out maybe they cause the opposite phenomenon, and the one that I illustrated was statins. But, now with a recent article talking about that maybe with injuries, and they illustrated with back injuries, maybe the appropriate approach is just to let nature heal itself, because your immune system was designed to heal yourself. And, there's wisdom to that. So But remember that the one drug I actually takes was ibuprofen. They were saying it's a mistake to take ibuprofen. So to me, that sort of more integrative health approach to me was a little of a bridge, a little bit too far. I was prepared to let statins go because I don't take them. But ibuprofen, I said, well, I don't know about that. So the point is this: the formal treatment and approach for injuries is, as I said, icing and taking non-steroidals initially. Article comes out, says that with people with back injuries, that those who just let the nature heal itself did better long term than those who took ibuprofens. So this is how I approach information when there is new information that seems to contradict an existing practice. If it is a little bit of a bridge too far, I do pay attention to it, but I like to think, I want to see other examples, other studies that show the same phenomenon. And I think that's very critical to pay attention to that you can't just accept one thing as, well, now I'm throwing everything away. This is interesting. And it clearly, like with many of these things, there is grains of truth to it. That yes, the body is designed, and this is something that I've talked to a great extent about. I'm a great believer that our immune system is very critical to managing everything in our health, but the immune system oftentimes needs help. So the concept of abandoning all these other things, to me, is a bridge too far, and maybe the middle road is appropriate. With many injuries, maybe try not to certainly to over medicate, and again, following the Goldilocks principle of being in the middle road. And I think that would be how I would deal with that subject. I want to see other papers on it, and interesting idea. So that's why what I found myself now after 35 years of medical practice and 35 years of being a thought leader, which is to say, having written extensively in the academic literature, both textbooks and peer-reviewed articles. I have thought very intensely about medicine for all these years. I want to convey that wisdom to you. First principle is, as I said, to be open to question that what you thought is gospel may actually be incorrect, but if it's far afield from what you think is correct, you need to have more proof. And probably the reality is then with many things, the middle path is correct, particularly if the alternative is not doing anything, which more and more I'm a great believer with imaging, because quite often my response to many people is, well, maybe don't need any imaging when they ask me about imaging. So I would describe myself as a formal medical doctor who is open to considering other ideas. So I'll tell you just briefly, and then in future I'll do other presentations on this very subject with other illustrations. But the problem I have with formal medicine is that, now backtrack a little bit. Formal medicine emphasizes randomized controlled trials, RCTs. And that to me is something that I fully agree with is a gold standard. There's a few problems though. One, if a company is paying for the trial, well, you have to remember there is that bias in there. And I kind of laugh about the fact within the earlier days, looking at iodine contrast in CT, that, and it doesn't matter, low osmolar iodinated contrast or isoosmolar iodinated contrast. Turns out if you saw who was the sponsor and paid for the study, that agent was the agent that was the safest regarding kidney failure, which is the big issue with iodinated contrast. So the issues with formal medicine is too heavy bias of companies, so you have to pay attention to that. Two, the problem with a randomized trial, if you group a whole bunch of people in it, it sort of drowns out the fact that, number three, there may be a subgroup that actually benefits from it that the larger group sort of drowns out. So I like all that aspects, but the problem is the money in formal medicine. And with that, I'll end this presentation. Thank you.